Hi, everybody. It's Margaret Watt from the Hub with our Mental Health Awareness Month video series. And today I am joined by Maggie Young and Jeff Greenblatt. Maggie, you are the Chief Recovery Officer at Liberation Programs. Jeff is the Program Officer at the Connecticut Counseling Center's office in South Norwalk, and Connecticut Counseling is also statewide. So here we are, hopefully approaching the beginning of the end of the quarantine, but we're a couple months into this. How have you changed what you guys are offering in response to COVID? And also, how are you just seeing, I know you're both still offering services. How have they changed? And also, what are you seeing among clients and in the population? How is mental health and substance affected by all this? Maggie.
Reach Band, which is in Stamford and in Bridgeport, medication-assisted treatment. And we are still out at least one day a week. With regards to our services, we are open. We have extended hours. We have, with our medication-assisted programs, we've actually been able to give additional bottles so that individuals are not needing to be in the clinic as frequent. And we've gone as far as 28 days for some individuals to get their bottles. With regards to inpatient services, we are continuing to admit, and we're screening heavily, and we're making sure we also have quarantine area just in the event that we needed to have that at both sites. And so we're utilizing telehealth and telemedicine to make sure that we're able to continue to connect to everyone and reach out consistently to check in with people. Anxiety is very high for everyone, including staff. And so we are actually making sure that we're connecting, because early recovery and treatment, inpatient treatment, outpatient treatment, it's all about connection, and it's all about really socialization. And so everything that we've ever taught anyone is to connect and to be together. And now we're saying, no, you cannot have that. So if this is people are a bit at risk, and the anxiety is increasing a great deal.
Yeah, I'm sure. Jeff, how have you guys adapted, and what are you seeing?
Well, we're seeing a lot of the same things. The two words that come to mind is anxiety and fear, especially at the beginning. Like you said, we're heading towards hopefully reopening, which has helped alleviate some of the fears and anxiety. At the beginning for us, it was rough because, we have all these like DPH and DA telling us one thing and then the next thing. So people didn't want to come see us, and they're here coming every day. And they were scared, including staff. Staff's like, are we going to close? And I had to explain, we will never close. And everyone was like, am I going to get my medicine? We will never close. The medicine will always be there for you. And I can guarantee that. But I don't want to come down every day. Staff didn't want to. Patients didn't want to. So we slowly got things into place where they're here once a week, twice a month, once a month. Now, that also becomes a problem, because now that connection, that socialization that Maggie was talking about, it's not there anymore. And then you're in isolation, and, we know what happens to people who isolate in recovery. They don't have their meetings anymore. They don't have their groups. So my counselors have been reaching out to them 3-4 times a week. They can always call us, and they can always get through to somebody. And what I've noticed is that they really look forward to, even though the COVID is out there and it's all about, staying away and staying home, they look forward to their coming down. They were begging us to let them do groups in person. Like, we'd love to do that. Our place is not big enough to do social isolating groups because it's just the rooms are too small. So we offer them Zoom, Zoom IOPs, and we've got they're full, which is amazing. At the beginning, it was a little touch and go with technology, but we've ironed all those kinks out, and it's like we have to possibly open up a new IOP because people are just really want to get in. So it's been great, and it's really nice to know that we're helping, and they appreciate it. Our clients really appreciate it.
Well, it's so important, and like Maggie said, I mean, anyone who is, if someone's struggling with addiction or mental health, being isolated is the worst. You need that connectedness, and you guys are making it happen one way or the other, in person, Zoom, online. And I think anyone watching the video should know that other providers are also doing that. Really, mental health and substance treatment and recovery groups are available right now. It's just, you got to access them a different way. I know one of the things that has come up is that people who have state funded phones were nervous that they wouldn't be able to access groups that way because they would have limitations. But during COVID, all those limits have been lifted. People have unlimited talk and text. They have more data, even on a state phone. So people should be able to access stuff. So what, next week, by the way, is National Prevention Week. And so thinking from a prevention perspective or maybe early intervention perspective, I know that with coronavirus right now, I think a lot of people are dealing with the stress by maybe turning a little more to alcohol or nicotine or marijuana than they may have in the past. And there may be families who are realizing for the first time that someone in their household needs help. What advice would you guys have to them?
I think this is really a big piece. And so when we talk about sheltering in place, in addition to, we know that alcohol use has increased, and as a society, we have a tendency to reach for something for comfort. And so as we are sheltered in place, we're within the home and we're within family, where typically everyone is so busy doing something else. And at this point, it would really be important for families to pay attention to one another and any behavior changes, things of that sort, and to also do some face-to-face contact. Decrease the screen time as much as possible, have conversations, because it's easy to isolate while in addiction or needing recovery, things of that sort, while in a home, if a person is used to actually trying to hide how they feel. So making some connections, checking in with one another, and don't assume that everyone is okay.
Yeah.
And so making sure that there is always some connection that is made within the home, within the family, but also reaching out. And as Jeff said, just knowing that treatment will always be open. We're always here, we're available. In addition, the Al-Anons and things of that sort, they also have Zooms. There are a lot of resources where there are support groups for individuals and for families. And but stay connected and ask the question. Make no assumption that everyone is just okay, because no one is okay right now. The uncertainty is big and is real.
Good advice, Maggie, and that's such a positive message that everybody's doors are open. But yeah, we're all in this together right now. Jeff, do you have anything you want to add to that?
Yeah, I mean, I'm looking at this new telehealth and Zoom and all Ring Center, all these things as a wonderful opportunity, because one of the things when someone answers the phone in the front office, people calling for whether it's methadone, mental health treatment, whatever it is, I say put them through to me or put them through to a counselor, talk to them, because they're having that moment of clarity. You talk to them, and if you can get them in the door, get them down here, and then we can help. But you know how many things can happen once that phone hangs up and they lose that moment of clarity, or they're on their way and they get sidetracked, or they change their mind. But now we have a face-to-face, and I think that gives us an opportunity. So this is something that might, good will come out of it. We'll continue to do this after this pandemic's over. Instead of saying, give me the phone, let's see if we can hook up a face-to-face. You make that connection, which is so important. Any silver lining that has to come out of this, and maybe this is one of them.
Maybe this is, yeah. You've already talked about the fact that your doors are open, services are available. I mentioned that, state phones shouldn't be a barrier. What if people are worried about how are they going to pay for services that they might need?
Let's say we're here for support, and anything that needs to be worked out, we work it out. If there's a need to assist a person in getting benefits, we could do that. We are not, priority right now is support and services for individuals, and then we work that out at a later date. So we don't want that to be a barrier for receiving services.
Great.
And just to add to that, the state of Connecticut has been wonderful. A lot of people who didn't have state insurance now just picked up the phone, and one day they didn't have it, the next day they had it. They've also waived authorizations now, pre-authorizations. So IOP right now, it's all covered, no issues. So yeah, just call up, and we can get you into treatment right away.